First of all, I'd like to introduce myself. My name is DR AHMED ADEL, obstetrician gynecologist specialist, consultant IVF and ICSI. This video, I'm supposed to be talking to you about an important topic and item, which is going to be the family planning. It's very important to know that family planning is one of the many important titles and items which is very important in the life of a woman. Some special points are related to this, including why do we need family planning? Family planning is very important because it actually gives a chance for the mother to make a proper spacing between pregnancies, so the mother can be able to take a chance once again to regain her health. First point. Point number 2, it's important for making proper management for cases of subfertility or even infertility, which is very important. And by the way, I like to use the word subfertility, not infertility, because actually you can't say that this female is completely infertile unless you make all the proper investigations and all the trials to get her pregnant. If not, you can say she's infertile. Otherwise, she's still a subfertile female. Point number 3, which is very important, is to make a proper way of handling multiple abortions and genetic counseling. This is the first point of why do we need family planning. So, what are the main important steps of family planning or types of family planning? It's very important to know that it's going to be divided into 6 main important items. First of all, the physiological method. Number 2, mechanical method. Number 3, chemical method. Number 4, using intrauterine devices. Number 5, which is going to be using the hormonal method, and the last one will be using the surgical method. It's very important to know that physiological method depends on the physiology of the body and your acceptance and understanding of your physiology. First of all, it's going to be the safe period, which depend on the following. Safe period means that I need to know exactly what are the main important points and the main important signs that give me the chance to be able to understand when my period will come, like taking good care of my basal buttock temperature, the change in temperature of my body, cervical mucus, and which is very important, is going to be the mesh contractures or the pain which can be found in one of the ovaries or even both, which give me the chance to be able to know the proper timing of my ovulation. So it's very important. And in some conditions, we can use which called the LH kits, which help me to be able to know, according to the LH surge in my body and the concentration of LH in my body, when the ovulation is going to take place. Because actually, ovulation takes place after 36 hours from the LH surge. So this is going to be the first point. Point number 2, which is going to be also a part of physiological method, will be using the prolonged mechanism of lactation. Why? It's an important point and it's hormonal part. Why? During lactation, the main important hormone controlling this mechanism will be the prolactin. So the secretion of prolactin will be causing a negative feedback mechanism on the GnRH hormone, gonadotropin releasing hormones, which is responsible for acting on the pituitary gland to produce FSH and LH. So in this condition, when the prolactin level is high, consequent to this, FSH, LH will be low. And during proper lactation, prolactin level will be increased, will be high. So it's going to be one of the main important points which help the female to be able to avoid pregnancy by the physiological means or the method. And the last 2 points we can talk about will be the coitus interruptus, coitus interruptus, which is going to be related to the male himself during sexual intercourse. And in spite of ejaculation into the vagina, you can just drag out your penis and make the ejaculation outside, which is very important. And it needs lots and lots of practicing, but it's still effective. And this is going to be the main important points related to what's called the physiological method for controlling and dealing with controlling of pregnancy as a part of family planning. Point number 2 we're talking about will be the mechanical method, which depends from the name on the mechanical mechanisms for controlling this. Why or how? First of all, we can use the male condom, we can use the female condom, we can use what's called vaginal diaphragm or even vaginal sponge, and in between the cervical cap. These are all mechanisms like coverage made from plastic materials or even inner part. Some of them made from polyurethane, some of them made from polyethylene, used to be introduced inside the female vagina or even the cervix to avoid the passage of the sperms from the fornices and passage back up through the uterus to make the proper fertilization of the ova inside the ampulla in the tube. So all of these methods are considered the mechanical methods which prevent the passage or even the swimming of the sperms to reach the ova to make the fertilization. And all of them seems to be completely having the same mechanism or idea. And some of them, in some cases, we used to add spermicidal materials which contain autonoxonol or nonoxonol 9 added to this diaphragms or this condoms or whatever to prevent the passage of the sperm by killing them, actually not only affecting their mortality. So it's going to be the second point we're talking about, which will be the mechanical method. If we talk about other methods like which called the chemical method, which will be including like cream, foam, sponge, effervescence, and some other things like sea foams or egg jellies or something. This will be introduced through the vagina to do the same function which is going to be preventing the passage of the sperm or even killing them and prevent them from reaching the ovum to make the fertilization inside the tube. This is going to be the third point to be talking about. We actually talked about 3 important points. Number 4 will be using the intrauterine devices, which is very important. And this is considered to be the most common way of contraception known worldwide. It could be divided into 2 main points. Number 1, inert IUDs or others which containing like copper or even silver, or even medicated which containing levonorgestrel like Mirena here in Egypt. The first method will be only a plastic material which is inert without any kind of reaction inside the body, preventing the passage of the sperm to make the proper fertilization of the ovum. Number 1 is going to be like leaf loops, which is double S4. First point. Point number 2 will be using the medicated ones, or even the ones using other materials, not only plastic like copper or even silver, including CUT380A or maybe Novati or Novogard, and the last one of them will be like the multi-load. The last one of them, which is going to be the medicated, make a proper combination between the mechanical methods and the chemical methods and even the hormonal method. Mechanical method by preventing the passage of sperm because of the shape of the loop itself. Point number 2 is going to be the mechanical method by preventing and making proper position inside the uterus which prevent the passage of sperm. Mechanical method, we talked about it. Chemical method by the presence of both copper and silver, which affect the motility of the sperm. And the last point will be the medication or the medical part of this kind of intrauterine devices like Mirena, which contain levonorgestrel. So according to this, we make 3 combinations of different types of contraception in one method, which is going to be like in Mirena. This is going to be the first point to be talking about, and point number 5, which will be the hormonal method of contraception in family planning, which will be divided into number 1, COCs, combined oral contraceptive pills, POPs, progesterone-only pills, injectables, which could be combined or even single, which like Depo-Provera for example here in Egypt. Point number 4, which is very important too, like implants and some of them others like patches which can be introduced outside the body by being put on the skin or even the arm. And the last one of them will be using the vaginal piercers, which is not be so known here in Egypt actually, because maybe a little bit different and because of some sort of difference in cultures or something like this, so it's not so much being used here in Egypt. So it's very important to know that. These are the main important items. If we talk about the COCs, it's very important to know that it's going to be combined of both estrogen and progesterone. So we have an estrogen part and progesterone part. Estrogen part could be divided in 3 important forms of estrogen like ethylene estradiol, mistranol, and estradiol valerate. What is the difference between ethylene estradiol and the mistranol? Mistranol is going to be exactly like ethylene estradiol but by a methyl group which is going to be added to it, which can be completely differentiated or maybe specified or even taken away through mechanisms in the liver. So it will be converted from ethylene estradiol or mistranol to what's called ethylene estradiol once again to be activated and be able to carry its function again. This is going to be about estrogen. If we talk about the progesterone, all progestins, it will be divided into 4 important points: first generation, second generation, third, and fourth. If we talk about the first generation, will be divided into 2 important points: estrans and pregnans. Estrans will be northestrone, northindrone, and norgestrel. First point. Point number 2 will be which called dipomidroxyprogesterone acetate, or which called medroxyprogesterone acetate is going to be the point number 2, it's going to be the pregnans. After that, we can be talking about point number 2 is going to be the second generation, what we'll be talking about the levonorgestrel, which is very important and need to be known properly and well. After that will be the third generation, which will be some other drugs like Marvelum, Genera, and Celeste. Each one of them have a specific form of progesterone, which is different from one type to the other one. Like for example, in Marvelum will be desogestrel. Point number 2 will be talking about the Genera will be Gestoline, and point number 3 where we talk about the Celeste will be Norgestimate. And the last point to be talking about will be the 4th generation, which will be like Yasmin in Egypt, Drospirenone as the progesterone part of it. It's very important to know that this kind of hormones, which will be taken in form of tablets, will be divided into monophasic or biphasic or triphasic. And according to the condition of the patient, it's very important to know that we use the proper method of contraception according to the condition of each single female. It's very important to know that we have more than one method of contraception, so it's very important to know every single detail about your health, about your age, about if there's any kind of specific kind of habits like smoking or alcohol or something like this, because actually every woman has her own situation, so we need to find the proper method which will be coping with her condition. So it's very important to know that using the proper method of conception is one of the most important points and targets in making a proper family planning. So it's very important to know that drugs effect and hormonal specifically will be different from one female to the other one. And after talking about this point about contraception will be using the contraceptive pills, or which called the hormonal method, there are other 2 points which is very important, divided between male and female, which will be the surgical part. If we talk about the surgical item, it's going to be divided into 2 important points, as we said before: male part and female part. Male part will be through which called the vasectomy, female part which called the laparoscopy, or male laparotomy like pomeroy operation, which is very important as we use to make some sort of ligation for the tubes, prevent the passage of the ova from the ovary, to give a chance for the sperm to pass to it through what's called the ampulla inside the tube, to make a proper fertilization after the passage through the tube completely to reach the uterus. In this condition, we'll make some sort of interruption by avoiding the continuity of the tube, prevent the ova after being fertilized from passing from the ovary to the uterus. And in this condition, as we make a proper ligation, so there will be even no chance for fertilization, because there will be no way for the sperm to pass from the fornices through the uterus, reaching the tube, which is completely, by the way, ligated actually, so it will be no way for making or reaching the condition of a fertilized ova. So it's very important to know that the ligation is one of the methods which is used for preventing pregnancy, and it's considered to be one of the types which is going to be like a reversible method of contraception. So I think after all of this, we have reached and we talked about most of the items which is very important during the family planning, and I hope this video was good and it was so vicious, and I think there will be more than one video. You can be able to keep it up and keep watching me through my channel on YouTube. Once again, Dr. Ahmed Adel. I hope it was a vicious video, educational one, and at your service, man. Thanks for watching.